Good evening to participants across India and the globe. Welcome to the 9th edition of Healthcare Insights, powered by RedMed and hosted by LBM Tech Solutions and All Ladies League. I am Meghalai Sendil Kumar and I head LBM Tech Solutions, a digital marketing company, and I am the host for this evening. Today's topic is urinary tract infection, busting myths. Thanks to Sandhya and Jay of RedMed, we have had several eminent speakers grazing healthcare insights in the past. And RedMed Health Systems is a connected health venture that has the goal of empowering people to lead healthy lives. You can know more about RedMed by visiting www.redmed.in. And today's expert speaker is Dr. Prasanna Venkatesh, who is a senior consultant, pediatric urologist and managing director and a practicing pediatric urology at NU Hospitals, Bangalore since 2003. NU Hospitals is the country's first standalone nephrology and urology hospital to achieve the dual distinction of being both NABH and NABL accredited. A gold medalist in MBBS, he has had training abroad in the field of pediatric urology at the Cleveland Clinic, Columbus, Ohio, and at the Boston Children's Hospital, Boston, USA. At various state and zonal level urology conferences, he has been a recipient of awards in the Best Paper and Best Video Presentations category. His other interests are IT in hospitals and hospital administration. He is currently pursuing expansion plans and has launched new units in Rajajinagar in Bangalore, Ambur in Tamil Nadu, Malé in Maldives, and Shivamogga in Karnataka. He has been instrumental in bringing down the costs of establishing a world-class facility with the use of technology and quality material and equipment sourced from around the world so that this benefit can be passed on to the patients. He is also actively working on bringing forth various philanthropic initiatives in the field of nephrology and urology so that those who cannot afford the current medical costs, they may receive quality and timely care. That's very wonderful, doctor, and so happy to have you here as our expert speaker here. Welcome to this session. And welcome moderator Jay Srinivasan. He needs no introduction for the regulars here. The moderator for this session, Jay Srinivasan, founder and CEO RedMed. Extending care by design is RedMed's tagline, and it outlines how they attempt to address challenges in healthcare by expanding it beyond its customary confines. Those regulars, you must have noted, various kind of speakers in healthcare who Jay and Sandhya have brought in, such wonderful speakers. Jay, suave moderator, wonderful moderator, and the floor is over to you, Jay. The floor is yours. You can take over. And participants, after the moderated session, you can put up your questions in the chat box and doctor will address them one by one. Thank you. Over to you, Jay.
Thank you, Meghu. Thank you for that wonderful introduction to Dr. Prasanna. We are really glad to have Dr. Prasanna here today, and hopefully we are all hoping for an excellent session where he could describe many of the things that are being experienced today by people in the country, especially seniors, and perhaps you could shed a lot of light on many of those issues. I should also mention that my mother is also watching the program. She has been your patient as well, and she constantly peppers her conversations for some reason during lunchtime on these issues. So we really would like to have those answers to many of the questions that people have so that the audience are well informed. At the outset, before we begin, at the risk of sounding quite ill-informed, I would like to start off with a single question to you, doctor. If you put yourself in the shoes of a lay person like myself, and if you were to enter the premises of a hospital, one of the things you notice is out on the wall, there are a huge list of departments and specialists. And I want to start with that because many of those things are Greek and Latin to all of us. So let's have some idea about UTI, urinary tract infection, urology, gastroenterology, endocrinology. I'm just sticking to 3 things. There could be a lots more. Could you differentiate between the 3 of them?
Okay. A good evening to everyone, and thank you to both of you for your kind introduction. Over the next hour or so, I would like to keep this discussion very interactive. Uh, Mr. J can interrupt me at any time if there are any questions. To answer your first question, Jay, is I do agree that the number of specialities that are getting into medicine are so many. And in fact, it is getting fragmented, but we need to look at it the other way, that there is so much of development happening in the field of medicine that I think there is no stopping going forward. Broadly, urology deals with the surgical aspects of the genitourinary system, which includes the kidney, the ureters, the bladder, the prostate, the urethra, the testes, and the female and male genital system. So that is what urology deals with. While it started off as a surgical specialty, over the period of years, what could have been dealt with surgically is now dealt with excellent medications. Urology also deals with something that we do very often. All of us need to go and pass urine 6 to 8 times a day. And urology makes sure that the plumbing is all right and make sure that everything works well. So that's about urology. Gastroenterology is again divided into medical gastroenterology and surgical gastroenterology that deals with the entire gastrointestinal tract, starting from the esophagus, the food pipe, the stomach, the large intestine, the small intestine, and the liver. So this is what the gastroenterology deals with. You again have the medical side and the surgical side. For example, the medical side for the kidneys are the nephrologists, who look more into the function of the kidney and whether whatever it is supposed to do, everything else is taken care of. So the medical side is taken care by the nephrologists. To answer your last query about endocrinology, our entire body is controlled with hormones. There are different hormones secreted by different glands. For example, the thyroid and the parathyroid glands, which are situated in the neck. Similarly, you have a pituitary gland, which is situated in the brain. You have the adrenal glands that are situated on top of the kidneys, etc., etc. So these are all hormone producing glands. And the study of that, the treatment and diseases of the endocrine system, which is the hormone producing system, is what endocrinologists deal with. And endocrinologists also deal with things like both your testosterone, estrogen in men and women. If there is an excess, there are problems. If there is a paucity, there are problems. So they also deal with all of that. So that covers the entire specialty of endocrinology. Again, you have the medical and the surgical endocrinologists in that. So that answers your questions, Jay.
Thank you, doctor. Much appreciated. So I assume there is a lot of overlap between these because looking at it purely from a layman's point of view, again, what goes in comes out. And somewhere along the way are those other specialties, and somewhere at the exit route is your specialty.
Yes, you're right. You're right.
Okay. Right. Thank you.
Another thing that's very unique about urology as a specialty is that what we're trying to do is to access the entire urinary system through the place which we pass urine. The amount of technology that is involved, the amount of innovations that are coming in, the instrumentation that is progressing rapidly worldwide is simply immense in the field of urology. Because what started as open surgery and laparoscopy, and now it's more of endoscopy and robotic. But long story short, that today 80 to 85% of urological procedures, we are able to do it endourologically, means we are accessing the urinary system through the tip of where we pass urine, both in men, women, and in children. And then we are able to get into the urethra, the bladder, the ureter, and the kidney, so that there are no incisions, pain is less, hospital stay is much less. So the urology as a specialty also has the maximum number of medical journals. And following urology is radiodiagnosis, which deals with CT, MRI, PET CT, and things like that. So these are specialties that are growing very, very rapidly. And it would not have been possible if not for the technology that comes along with it. So there are a lot of engineers, biomedical engineers, a lot of them working very, very closely with these specialties. And amongst many, many fields of medicine, I think the symbiotic relationship between technology, engineers, doctors, surgeons, and physicians has come together very well in specialties like urology and radiodiagnosis.
And many of these advanced services, doctor, are currently now available in India as well?
Yes, yes. And whatever is available in most parts of the world are available in India. That's the good thing, including genetic testing and everything else. Earlier, the time lag used to be 15 years, somewhere in the late 90s. In between 2005, 2010, it came down to around 5 years, whatever happens in the West. And now it's almost real time, 3 months to 6 months. So Indian healthcare has progressed significantly right now.
Okay, and this is this question from me now is a little digressing from the main points. So if they are available, if these technologies and new science is available to us in India real time almost, how do doctors get to train themselves on these advanced techniques so that they're up to speed on them?
Yeah, see, there are two components to this. There is a medical side. If the medical side, that doesn't require any training as such. It's more of reading, making sure that these medicines are licensed, both in India and abroad, and then you take it forward. The point about anything that is coming into mainstream healthcare doesn't happen immediately. There is a progression. It takes, for example, for a drug to get launched in a market, especially if it is a novel drug, it takes anywhere close to 6 to 7 years from the time of, or even more, from the time of conceiving an idea to doing the studies and animal studies, clinical trials, etc., etc. So people who are specialists in their own field are keeping themselves up to date with whatever the progress that's happening. So that's on the medical side. Similarly, on the surgical side, what happens is that today it's more of videos, looking at the procedures, making sure that that those equipment come, and then taking it forward. Unless it is a completely new procedure where somebody requires to go and get trained. And today there are simulators, there are surgical simulators that are available where a reasonable amount of training can be done. And see, this is for all surgeons who are already operating. It's not for the new surgeons. So it's mainly that they improve on their skills as time comes. Again, I'll take an example of urology. If you have a urologist, say, who's 55 or 60 years old, over the last 20 years, what he learned, what he studied, and what exams he took when he graduated is no longer relevant now. So over a period of time, I think doctors, especially super specialists, they would need to keep themselves updated, and technology is evolving. The surgical expertise and skills are evolving. So this is something that it is going to be one continuous learning process for doctors also.
Okay. And I assume there is an equally rapid application of the latest science and technologies at the education level itself. For example, a student who is pursuing an MD in urology?
Not so much in the MBBS, in the undergraduate and in the graduate level, but in super specialties level, definitely yes. And it also depends upon which institutes that particular student is getting trained.
Okay.
I mean, you're well aware that in India, I mean, most parts of the world also, there is no standardization, if I may use that word. And it's very paradoxical. In government hospitals, large government hospitals, you get a lot of patients, so they get a lot of training, but you may not get in newer technology and newer equipment that rapidly. And it's the inverse in the private institutions. So I guess it's a balance.
Okay. Okay. Diving into UTIs specifically, how do you see the demographic fallout or division in terms of occurrence of UTI problems among men and women? Is there a difference?
Yeah, there is. I have that in the presentation. Can I just open that up?
Certainly,
Is that okay?
Certainly.
Okay. Just give me a moment. I'm sharing the screen. So I will run you through over the next, say 15-20 minutes or maybe a little longer. But Jay, feel free to stop me anytime. And
Sure.
if you have any questions that you can interject, you're welcome.
Mm-hmm.
Can you see the screen, please?
Yes, we can, doctor. We can.
Okay. We don't have proper statistics in India. So I've just picked up the US, which has probably 1/3 the population of India. And urinary tract infection has, I mean, these are the statistics, and these statistics are huge. If you look at the healthcare burden that urinary tract infection puts on the healthcare system, it is quite significant. And therefore, when we were deciding on a topic, we thought that this is something which would be very useful for anybody who is listening. Now, what do you mean by urinary tract infection? It is broadly divided into the upper tract and lower tract. The upper tract typically covers both the kidneys and the ureter. The ureter is a tube that drains the urine from the kidney to the bladder, and the lower tract covers the urinary bladder and the urethra, which is the tube from the bladder to the tip of where we pass urine. That's called as the urethra. So if you have infections anywhere here, it's called as urinary tract infection. One rider in this: if you are having burning sensation while passing,
Doctor, you've gone off video.
will not cause fever. Lower tract urinary tract infection is much simpler to treat, and most of the time they do very well with simple medications. When a patient with urinary tract infection also has fever, that means the kidneys are also involved.
Doctor, if I may interrupt you here, I think you went off the audio for a little bit. I don't know if it happened to everybody as well. So would you mind going back about 30 seconds to repeat what you said?
So what I was telling is lower urinary tract infection has only symptoms: burning sensation, urgency, increased frequency. Your upper urinary tract infection will also have fever.
Mm-hmm.
So having fever with UTI is not a good sign. It requires to be addressed very soon. So the topic today was multiple myths. I wish this could have been a face-to-face meeting. I would have asked all of you to lift your hands, because I'm going to ask you a couple of questions. Well, you can say yes or no to yourself, but just listen to these questions. Does increasing water intake help prevent urinary tract infection? You answer the question.
And put it in the chat box. Doctor.
Yeah, you can put it in the chat box, and also just remember your answer. Okay. Right. Drinking lots of water flushes bacteria out of the bladder. Simple questions these are. Right? Think about it, and then we'll come back, because these were all the myths that surround UTI. For patients with urinary tract infection, what would be the advice? 2 liters of fluid, 4 liters of fluid? You'll have to choose one. People who drink less water, are they prone to urinary tract infection? So I'll take this further. So do you think 4 liters is better than 2 liters? Keep thinking about it. Or is 8 liters better than 4 liters? One liter? 2 liters? 8 liters? 25 liters? Or a full overhead tank? Waterfall maybe? Okay. I will answer this question, but the most commonly discussed question is that when somebody has urine infection, they tell them to take a lot of water. While it may be true some of the time, but most of the time, in fact, it is detrimental. So that's one myth which I would like to clarify on that. So the amount of water intake that you need to take depends upon multiple things. What is mandated is that adults, all of us, should be passing 1.5 liters of urine per day. Now, how do you get that 1.5 liters of urine? Generally, if you take around 1.5 liters of water, generally. But it also depends upon the climatic condition that you're in, which geography you are. Is it hot? What is the ambient temperature? Are you working in an air-conditioned environment? Are you exercising? Are you a sportsman? Are you a construction laborer working in the hot sun outside, probably in Chennai, etc., etc., etc.? So the amount of fluid intake that you need to take depends upon all these things. Ultimately, you need to pass around 1.5 liters of urine. Again, tough to measure, because in practical terms, it's very difficult to measure whether you're passing 1.5 liters of urine. So good thing is that your urine color should be amber color or clear. It should not be dark yellow. If it is dark yellow, it means it's concentrated. The amount of fluid that you're taking is less. You need to take more. But generally, people who are not leading a very active lifestyle, say a sedentary lifestyle, predominantly indoors, 1 to 1.5 liters of fluid is enough. If you're exercising, you need to take more fluid around the time that you exercise. Okay, so that is one. Because as time goes, I will tell you why more water is also not good. Quote unquote hydrotherapy and all that stuff. Okay, as we go, I'll tell you that also. The second series is, does poor genital hygiene predispose to UTI? Just answer yes, no, whatever. I keep it in mind. Women who use public toilets are prone to UTI. I think this picture of the diaper for a child, where on the right side of the screen, the baby has passed urine, and on the left side, the baby has passed stools. Nothing happens. All these children don't get infection. A big chunk of the world's population, babies, are on diapers now. Diapers of different types. It could be cloth diapers or whatever. Similarly, women who use public toilets also will not get UTI. You should understand that probably 30 to 40% of the world's population don't even have toilets, and they don't get UTI. I will elaborate on this also more. And then there are some more myths. How to prevent UTI? You should shower instead of tub bath, clean genitals before and after sexual intercourse, wipe from front to back. All of these are there all over. Wear cotton underwear, avoid tight-fitting jeans, wash genitals before intercourse, keep your urine acid. In fact, there have been certain people who are advising even to drink colas. Use only warm water to wash between your legs. Don't use perfume, soap, talcum powder around the genitals. And I'm not sure if you're looking at all these websites below. They all look pretty authentic. But whatever those statements, all these 3-4 slides which I showed you, all those statements are not correct. And then there are people who use D-mannose tablets, cranberry extracts, and things like that. Also for UTI, there is very little evidence that these all actually benefit. So what are the facts? There is no rationale on hygiene. Means with respect to urine infection, hygiene is something with respect to personal hygiene that all of us definitely need to follow. But with respect to UTI, hygiene has no bearing. Wiping patterns, use of hot tubs, type of undergarments, nothing. All of this has been studied, and all of these do not increase or decrease UTI. There is no association to pre or post coital or intercourse voiding, passing urine. No association of wiping patterns, douching, use of hot tubs, whatever, all of this. These are all proven. So what actually happens is there is an alteration between the host and defense mechanisms. The host is the human body. The human body is supposed to have reasonable defense against bacteria or fungi that cause urinary infection. The second is obstruction. If there is an obstruction to anywhere in the urinary tract, then that particular patient is susceptible for urine infection. And what would actually happen? What happens is the infection starts in the urethra and then goes into the urinary bladder. That is the site of entry of these bacteria. And after that, what happens? UTI goes on to become symptomatic or not based on the bladder pressures that that particular patient has. And therefore, the role of fluid optimization. I use the word fluid optimization because a vast majority of the population in our country, in India, don't take adequate fluid, means at least 1.5 liters per day. If you take too much, if you take 3 liters, 4 liters, 5 liters, and if you're not exercising and sweating it out, all that water that you take has to go into the bladder. And when it overdistends the bladder, the pressures in the bladder go up, and then you can again have urine infection. Another very, very important point is constipation. Constipation can occur in the elderly, it can occur in the middle age, and it can occur in children. Especially with the change in diet, lesser physical activity, constipation is something that is quite common nowadays, and constipation can cause urine infection. I'll show you how. A couple of slides on why this bladder infection is common. So if you look, this is just a picture. So you have a bacteria that is there here. It attaches to the bladder mucosa. It enters, the bacteria enters through the place where you pass urine. Therefore, perineal hygiene is important. Therefore, constipation is also important. Very simple. If somebody is constipated, the amount of bacteria in the perineum goes up significantly. The distance between the place where you pass motion and urine is hardly 4-5 centimeters. And therefore, this bacteria can attach into the urethra and the bladder. Then it invades into the bladder wall, and then it gets into the bloodstream. Or through the urine, the same way it can attach, invade, replicate, and then reach the kidney also. So that's how these are all some electron microscopic pictures on how this bacteria gets into the mucous membrane of the bladder, and then you can see that it grows tentacles, and then it invades into that mucous membrane and causes urinary infection.
Doctor, I would like to interject here for a moment. From what you have described so far, it would appear that with the exception of things like insufficient water intake or fluid intake, and things like inability to, lifestyle issues relating to food, the reasons, it seems to me, are predominantly involuntary. Would that be a fair thing to say?
That's right. I was just coming to that. You're right on that. You're right on that. I wanted to make the statement later, but I'll make it right now. Everyone who develops a urine infection needs to be evaluated as to why they have developed the urine infection. Barring some infections, which is something like, honeymoon cystitis, or, post-intercourse, where some of them develop some symptoms, there is a clear cause and effect relationship to that. But for everybody else, especially, you divide them into 3 age groups. You divide them into the pediatric age group, then you divide them into the reproductive age group, you divide them into the elderly. All children, all elderly above 50, 60, and all men irrespective of any age group. The only exemption in this is women of reproductive age group who are active sexually. Other than them, these first 3 categories, that is the pediatric age group, the elderly age group, men and women, and all men or boys of all age groups, have no business getting a UTI. If they get a UTI, it is usually there is a cause. And unless that cause is identified, invariably that urine infection will recur. So the cause can be multifactorial, but generally it is due to, like what Jay was saying, it can be due to things that you don't have control about directly. It could be due to constipation, uncontrolled diabetes, any obstruction in the urinary tract, anywhere in the kidney, in the bladder. And as you grow older, your prostate enlargement for men, any other surgical procedures that are done, any instrumentation, hospitalization, catheterization. And one of the most common causes of urine infection is also pelvic inflammatory disease, where women have vaginal infection leading to urinary tract infection. And both men and women with diabetes, if they develop urinary infection, it is an indirect indicator of very poor blood sugar control. So unless you take care of all these things, this particular person is going to have that infection again and again. So this was the simple graph which I was telling to you about the bladder pressures. That is why I'm again emphasizing that don't take too much of water. You have to optimize your fluid intake. You have to take sufficiently depending upon how physically active you are and in which part of the world you are, means what is the climatic condition there. So what typically happens is that when you overdistend your bladder, on the bladder muscle wall, there is decrease in blood supply that permits the bacteria to enter. This is just a very simple schematic diagram. So increased water intake, no evidence. In fact, it may be detrimental. Having said that, I would again repeat, a lot of people in our country don't even take 1.5 liters to 2 liters per day. Right? I'm talking about people who take 4 liters, 5 liters, 8 liters per day. And they're not keeping themselves physically active. Now, if you have, say, a basketball player or a football player or an athlete or a cricket player, obviously his fluid intake when he is there in the field will easily be 5-6 liters. Right? So that is one point I wanted to clarify.
Doctor, when you say optimized fluid intake, specifically water intake, does that exclude our normal consumption of food that has a lot of fluid as part of it, like rasam, for instance, in South India?
No, I agree. It includes, that's why I use the word fluid and not water.
Okay.
It includes coffee, tea, juices, and milk for children, and water. It excludes what you get in food. What you get in food is generally around 500 to 800 ml. And we excrete that 500 to 800 ml by breathing and in stools. So that sorts of, normalizes that. So does constipation contribute to UTI? That's a definite yes. And especially if you take it in children, more children are getting constipated because of the dietary changes. And that's the causal relationship which I have mentioned. And how does it affect bladder function? So this is the amount of bacteria per gram which you will have in a constipated person. This is the normal rectum, normal bladder, normal urethra. If there is a dilated rectum where the bowel is not emptying very well, the perineal bacterial count, that is the skin around the anus and the place where you pass urine, the bacterial count goes up significantly higher, giving rise to urine infection. That bacteria enters the urethra, gets into the bladder, and then I showed you how the bacteria gets into the bladder wall. And then to top it, you drink more water, you over distend your bladder, you further decrease that blood supply, and then that cycle starts.
I just counted the zeros. That's 100 billion per gram.
Yeah.
Wow.
Of bacteria.
Yeah. What bacteria are these? What specific?
Any bacteria. Mainly it will be Escherichia coli and Klebsiella. But yeah, there are many bacteria that can cause this. So if somebody, all of us have bacteria in skin. If somebody is not constipated, that will be 100,000 per gram. Somebody who is passing adequate stools every day. So your diet is important. The amount of fiber that you take in the diet is important. And you should make sure that you're not constipated, because constipation causes urine infection. One of the causes. It's not the only cause. So when somebody comes to us with urine infection, we need to look at all these multiple factors as to what would probably be the cause, especially if it is recurrent urine infection. How do you diagnose constipation? Of course, history and a simple X-ray where you can see, this is the spine, right leg, left leg. And then you can see the entire large intestine in the third picture at the bottom. Here also you can see all that mottled appearance, which is black. A simple X-ray will tell you. So what really happens to women who use public toilets? Would anybody like to answer that? Or Jay, you can answer that. Or what do you think is the misconception about public toilets?
You put me on a spot.
Anybody wants to answer, they can unmute and answer. Or you can type it in the chat box if you know the answer.
Jay, you need to unmute yourself.
The basic lack of hygiene and cleanliness in the premises in a public toilet that already hosts a lot of bacteria, which gives fertile ground to invade. If all those factors that you said are present, allows for easy entry.
Right. Okay. I'll answer that question for you. Most of the time, women, especially in our country, it's a little better now, but say 15, 20 years back, toilet access was a big problem. Men, wherever you stop on the roadside and they used to go. That they continue even now, whether the toilets are there or not. But for women, it was a problem. So they just couldn't go. And a lot of women developed what is called as a lazy bladder syndrome, where they tend to accumulate 1 liter, 1.2 liters, whereas the average adult bladder capacity should be around 400 or 450 ml. We will never get a urine infection from a toilet. Urine infection never comes from outside in. Having said that, there has to be some basic amount of hygiene. I mean, you cannot go into a soiled toilet. You understand the difference, right? The infection actually comes because these women are holding the urine and not passing on a timely basis, and then they're over distending the bladder. And to top it, because they're experiencing urine infections, somebody has told them drink more water. So they drink more water, distend the bladder, and then don't go and empty it because they don't have toilet access. So that's a winning formula to develop urine infection. So urine infection never comes from dirty toilets. Urine infection comes from the fact that there are people who don't pass urine every 3 to 4 hours in the daytime. They keep it for 6 hours, 7 hours. And this is across people who are busy at work, people who are traveling, they may be in a bus or they may be on the road, they don't have toilet access, and you have children with all their diversions which they have right now, they simply don't want to go to the toilet. So if you postpone the act of passing urine, and if that happens recurrently, there is a high chance that you will develop a urine infection because you are over distending the bladder. So that was the point that I wanted to make on that. So fundamentally, there are 4 things. You need to have appropriate fluid intake. I use the word appropriate because it depends upon the physical activity and the climate that you're in. I use the word fluid because it includes all fluid intake. You have to keep the bladder empty on a regular basis, right? Which is typically at least once in 4 hours during the day. You have to keep the rectum empty. And of course, if you develop recurrent urine infections, meet a physician, get help, make sure that you're not dealing with some other problem, like an anatomical obstruction or uncontrolled diabetes or something else, especially if it is recurrent urine infection. Now, in women, always look for a cause. You rule out an anatomical cause, check for obstruction, stones, constipation, fluid intake, and then I have marked something in yellow, which is dysfunctional voiding. That is typically they drink a lot of water and then don't go and pass urine on a timely basis. So then they develop something called as a dysfunctional voiding. Voiding means passing urine. And then there is another important cause. At the bottom, I have mentioned it as PID, which is pelvic inflammatory disease, which is vaginal infection, untreated, or fungal vaginal infection, white discharge, all of that causing urine infection. So that is something that requires to be treated.
So, Dr. Jay here again. So we have a list of causes here. Can we segregate the cause from perhaps the symptoms, some of which could be some kind of urgency, for example, constipation, the pain and the urgency? Are there any other symptoms that could trigger or identify these causative factors?
Yeah, see, if it is an obstruction, definitely they will have some abdominal pain or difficulty in passing urine. Means the urine stream doesn't come out freely, right? Constipation causing infection, then they know they also have difficulty in passing stools. PID, you will have vaginal symptoms also. So these are basic, simple things actually. See, the first time a woman has a, when I mean women, I'm talking about women in the reproductive age group, which is between 18 to 45, 50, and women who are sexually active predominantly. So it is not every time that you need to evaluate all of them with all the tests. That's why I segregated them into a separate group. It is only when they have recurrent urine infections or if they have fever with the urine infection. When they have fever, it means that the kidneys are getting involved. It's no longer restricted only to the bladder. These are women who require detailed evaluation. Men and boys of all age group, elderly above 50, pediatric age group, boys and girls, all of them require a full evaluation even after a first urinary tract infection, because they should not be getting it. So answering some of the questions of UTI in the elderly. Now, what happens is that in the elderly, the amount of bacteria that forms in the urine, because of age-related decreased immunity, plus the fact that a lot of them have associated diabetes, maybe 20% of the population, the amount of bacteria in the urine can also grow. And in men, what happens is that they have associated prostate enlargement. They may have some residual urine in the bladder after they pass urine. So again, the bacterial content can grow. So these are all things that definitely require to be evaluated. As I spoke about decreased immunity, some of them may have perineal soiling, some of them may be on catheters. Women may have estrogen depletion because the ovaries are no longer functioning. BPH is the prostate enlargement in men, and certain drugs may cause impaired or decreased movement. Now, all of these things can also contribute to UTI. This is, I'm talking in the elderly age group. So when anybody older develops urine infection, they require to be properly evaluated. Coming to the other spectrum, pediatric UTI, one problem is now, see, babies especially, or children less than say 2.5 or 3 years, they're not able to communicate and speak very well. So many times it's difficult to recognize. And then if you also look at the number of times in our own country, most children develop fever at least 2 to 3 times in a year, which is a good thing because they're developing immunity against a lot of viruses and bacteria. Most of this fever is upper or lower respiratory infection, or it is the flu, the viral fever flu. If they have that 2 to 3 times a year, it's good because they're developing immunity against it. And what happens is once you put these children in preschool or schools, they have a spike in these infections because suddenly they're exposed to so many children. And therefore, sometimes this UTI is difficult to recognize in children. Both pediatricians and parents think it is the regular fever. The second difficulty is collecting the urine in children is difficult for obvious reasons. You know, we can go and pass urine in a container. It's very difficult to collect urine from, say, a girl child or a boy. So therefore, sometimes diagnosis gets delayed, and these are developing kidneys, especially if they have fever along with urine infection, that may affect the kidneys. No child should have urine infection. If a child has urine infection, the child requires detailed evaluation. 90% of the time, we will be able to identify a cause. Cause needs to be treated, and therefore, hopefully, that infection will not recur. These are all the other different causes of infection in children. The important thing in children is you don't have too much of time. Better to evaluate them early and address it early so that long-term complications are not there. I have a couple of slides in this, but anyway, I'll just cut this short. There is something called as voiding dysfunction. You can see this first picture here. Some of you would have seen children crossing their legs. Instead of going to the bathroom, they don't want to go because something interesting is happening on the television or computer or video game or a game or something. So they just don't want to go. So girls cross their legs. Boys will hold the penis and dance around and wait for that urge to pass urine to go off. And then you have the curtsy maneuver, like how you curtsy in front of the king or the queen, where this child, what this kid is doing is pressing the heel against the urethra with an intention to avoid that urge to go. So if they hold it like that for a couple of seconds, that urge passes and then they can continue watching television or playing. Now, this is something that is called as voiding dysfunction. This is something that we need to educate our parents and educate the children also. Sometimes when you tell them to maintain a bladder diary, you'll be very surprised that a 5-year-old or a 7-year-old child passes urine twice in a day. And it'll be like 500 ml. So these are all causes of urine infection in children. This is something that I did discuss about. overall? So Jay, again, question to you.
Yes.
UNICEF started this, and then now our Prime Minister has also started the toilets. See, what happens in rural India? There were no toilets. So once there are no toilets, whenever somebody wants to relieve themselves, they go and relieve themselves. Now, the problem about toilets, I mean, I'm just giving you different perspectives, okay? Now, the problem about toilets is that you should have adequate toilets, you should have clean toilets, and you should have running water in the toilets. These three things are not there in the open space. I completely agree. In 2021, we should have sanitation. If we still have people carrying a jug and going into the fields for a country like India, that is definitely not acceptable.
Right.
But I'm just telling you the gravity of the challenge that is there on putting up adequate toilets. So if you don't have adequate toilets and then tell all of them not to go out in the fields, then you have a problem. Jay, any comments on this?
A lot of information to digest, Doctor. And as I go through these, there is a tremendous amount of very interesting information, as well as things which we have sort of absorbed in our thinking, which you have classified as myths, which are very useful to understand. One question that pops into my mind is, a person who has UTI has been tested and, let's say, treated. But UTI can recur, right, in any person? Is that a...
Yes, if there is recurrence of UTI, probably there are two things. One, the cause has not yet been identified, or whatever we have identified and treated is still not adequate. Probably there is a multifactorial cause. Like you can have a 55-year-old lady who has got a vaginal infection, diabetes, constipation. You need to take care of all the three. So I put up this for most men who go to the barber store, to the barber, and then the barber shows this mirror at the back. How many of us have actually said, you know, correct it like this, correct it like this? Nobody tells. Everybody just shakes their head. So a lot of the myths in UTI are also like that. No, everybody says, okay, go ahead. So again, cementing what Jay's question earlier, we will need to treat the primary cause in patients who fail simple conservative therapy. Now, not every burning sensation that you experience when you pass urine is UTI. Not every burning sensation that you experience. Burning sensation when you pass urine is called as dysuria, or painful act of passing urine is called as dysuria. Not every dysuria is UTI. One of it can be honeymoon cystitis, which I did speak about. First time when women have sexual intercourse. So this is something that they need to be warned about. Not everybody, but some of them. Constipation, very important cause of dysuria. Over distending the bladder and not passing urine on a timely basis. And then when you go to the bathroom and then pass say 500, 800 ml urine, you may develop pain or burning sensation when you pass urine, which is the over distended bladder that you can see here. This is on the left is a CT image. This is another problem where in public toilets, sometimes, this is taken in a railway station actually. I took this picture. So what I'm trying to tell you is that the social structure with respect to the sheer size of a population to the number of toilets that is available in public places is unfortunately very dismal. And all of this can also contribute to urine infection for all those reasons that I told. So actually you have a pregnant lady who's waiting, and imagine with an over-distended bladder. So these are all the preventive steps that we need to take. Please remember the fundamental four: optimum fluid intake, empty your bladder more often, make sure that your rectum is empty, that you should not be constipated. And anybody who has a recurrent infection requires evaluation. Thank you. Please go empty your bladders now. Thank you.
So, Doctor, before we have the audience chipping in with questions, I have a few of my own which we could cycle through, and some of them are, most of them are actually well answered by your beautiful slides. But I will go through them nevertheless, and then we can, Megu could open up through the audience and have them pose additional questions that they might have. When you talk about evaluation, and I noticed that you use the word quite frequently, good evaluation as the basis for discovering UTI. What is the nature of the evaluation other than the questions or the conditions that you just posed? Are there any tests that you have them go to?
Yeah, they're very simple tests. It's a simple urine analysis, maybe a
Okay.
urine culture to grow what to check what type of bacteria grows.
Okay.
X-ray to look for constipation if you're not able to figure it out on history itself. Definitely an ultrasound of the kidney and the urinary bladder with a full bladder, and after the patient passes urine. That gives a lot of information on any other structural abnormalities, anatomical abnormalities, presence of any other cause of obstruction, stones, etc. So at least the basic. And then depending upon the age group, if that particular person is a diabetic, you would also need to know whether the diabetes is under good control. And if they've not been tested for a reasonable period of time, it also makes sense to check them for diabetes. So this would at least be the baseline evaluation.
Okay. So basically urine test to identify bacteria. You have the X-ray to look at distension, if any, an ultrasound for any structural abnormalities, and what was the last thing you mentioned again?
Blood sugar.
Blood sugar level for diabetes. Okay. Okay. So that's fairly straightforward. And these come after your own evaluation, sitting across the table with the patient, right?
Correct.
Right. Okay. What if there was blood in the stool? Is that indicative of anything?
Blood in the stool is not indicative of a urine infection, but blood in the stool requires its own evaluation as to why it is there.
So it's a fork in the road that takes you off somewhere else.
Yes, blood in the stool is something very different, and then it depends whether it's fresh blood or whole blood, etc., etc. But blood in the stool also requires evaluation, not for urinary infection though.
Okay. And a typical question that often arises when we talk medicine or healthcare is the big elephant in the room, which is cancer. Does that figure in any of this in any way?
Whatever the basic evaluation that I spoke about, generally will at least give us an indicator towards whether somebody has any urinary system cancer. But urinary system cancers as a direct cause for urinary infection is not there.
Okay.
Simply the number of UTIs in the world is so much versus the number of cancers. So there's no direct relationship between these two.
Okay. I also noticed that, especially when it relates to children, you made references to lifestyle, food intake, types of food and all that. Any particular do's and don'ts there in terms of the modern living, of what kind of foods could sort of trigger these things?
Be it in children or even in adults, one thing what's happening over a period of time is the amount of fiber intake that we are taking is coming down significantly. I'm talking about the Indian diet. say the amount of fiber that we used to take 30, 40 years back to the amount of fiber that we are taking now has come down. The amount of processed food and refined food that we are taking has gone up. The amount of sugar that we are taking has also gone up. So these are three things that we definitely need to reverse. What I do tell patients is that at least 50 to 60% of your plate should be vegetables. It can be any vegetable. Whereas the amount of vegetable fiber intake has significantly gone down in the general Indian diet. There is a lot of carbohydrate. I mean, carbohydrate is also required. It is a very important component and a major component of food. And for those who have non-vegetarian, maybe the amount of fiber intake, vegetable fiber intake is even more less. So that is something that they need to take. And children, again, are exposed to a lot of fast food, which occasionally is fine. On a regular basis, definitely no, because it has a lot of salt and a lot of sugar. And both of that is addictive. And that's why the child craves for more of it. Because it's very high in salt and in sugar and very less in fiber. Okay. And then, they tend to put on weight, and then the constipation to top it. And then that leads on to a vicious cycle by itself. So dietary practices are something that we definitely need to watch. Okay. I think all over our country, the day-to-day dietary patterns are significantly changing.
Thank you. I have two last questions, and then Meghu could open up to the audience. One is the presence of renal stones versus UTI. Is there an overlap between the two?
Could happen. Stones themselves harbor bacteria, can cause urinary infection. The second thing is stones can cause obstruction to the urinary tract and cause urinary infection.
Okay.
So they need to be evaluated and treated.
Thank you. My last question, Doctor. Many of us have our parents or senior citizens or in-laws living with us. And one of the things that we frequently observe is that they are quite often harassed, if you will, during the night by having to get up frequently and having to go to the bathroom, right? This is actually a two-part question to this. Senior citizens do experience this. So the first question is, how can that be mitigated in some fashion? Because it is an inconvenience. It is a nuisance for people in their 80s to actually get up in the dark and turn on the light and then having to go to the bathroom with all the risk that poses. So that's number one. How can that be mitigated? The second thing is that something that is possibly a causative factor for a future UTI event that one should be conscious of?
I'll answer the second question first. Yes, it can cause urine infection. See, when the elderly wake up more times to pass urine, that is a condition called as nocturnal frequency. Now, for us as treating physicians, we divide them into a patient having nocturnal frequency with normal volumes of urine at night, or having excess urine output at night, what is called as nocturnal polyuria. How that differentiates is, see, by design, human beings are supposed to follow the sun. You're supposed to wake up when the sun rises, go to bed when the sun sets, and darkness changes a lot of hormones with us. Sleep changes a lot of hormones. Now what has happened with artificial light coming in, where instead of going to bed at 7:38, like probably what our forefathers did, we're going to bed at 11 o'clock. They used to be up by 4 o'clock or 5 o'clock because they don't want to waste sunlight, right? Now what happens is, sometimes if the sleep cycle is disturbed, the hormone cycle also gets disturbed, and then they start forming more urine at night, therefore waking them up more often. If something like that is there, that requires to be evaluated, point one. Second thing, what happens is maybe they're drinking too much of fluid after 5, 6 o'clock in the evening, having a late dinner. There is no time interval between dinner and bedtime. And therefore, they tend to form a lot of urine at night. And therefore, they need to wake up and go and pass urine multiple times. So what we advise them is to decrease the fluids after 5, 6 o'clock, have a little early dinner bedtime interval of at least 2 hours, pass urine before they sleep, and hopefully the number of times that they wake up in the night will significantly be lower. The third thing is maybe because of cardiac issues, they may be having swelling in the lower limbs, swelling in the feet or swelling in the lower limbs. Now, what happens for people who have swelling in the lower limbs? When they sleep, all that fluid which is there in the leg gets back into the circulation, gets into the blood, goes into the kidney, excretes out as urine, and forms more urine in the night. I think whatever question you asked, Jay, is a very, very pertinent question, and it is a huge quality of life issue. If you have an elderly person waking up multiple times at night and needing to pass urine multiple times, there are many ways in which this can be evaluated. We need to differentiate it medically by tests and history, etc., etc. We need to see if they are having nocturnal polyuria, what is their sleep cycle, are they forming more urine in night, is there some other problem, uncontrolled diabetes, what it is, or is there a cardiac problem relating to these? All of these things need to be checked, because if you take a step back, most people who have a fall in the night, most elderly people who have a fall in the night is when they actually get up to go and pass urine. And then what started off with something like this, then they have a fall and then they require surgery. You know, the whole, all started because they are passing urine multiple times in the night. Today, there is excellent evaluation, focused treatments available. If not to completely eliminate, see, anything more than waking up 2 times in the night definitely requires to be treated. I mean, if you can sleep without waking up for 6 to 7 hours, nothing like it. I'm talking in the elderly. Once if you wake up, it's okay. But if you wake up multiple times, the tendency to fall increases because you have not even slept properly and again you're getting up. So the number of times you wake up, you have an increased tendency to fall. So that is something that definitely needs to be addressed.
Thank you, Doctor. The very good point that you have drawn attention to, that hopefully is communicated effectively to everybody who has a senior to look after. Meghu, perhaps you can open up to questions from the audience.
Yeah, thanks, Jay. There are a few questions here, and if you have any more questions, you can begin typing, so I can just read it out one by one so that Doctor answers. This question was asked when you were talking about frequent voiding of the bladder, Doctor. What if one doesn't feel like passing urine every 3 to 4 hours? You said that you have to empty every 3 to 4 hours, but what if there's no feeling? Is that a problem, or is that okay?
It is probably you're not drinking adequate fluid, point 1. Or point 2 is probably you've become accustomed to holding a lot of urine. That normally when somebody gets an urge to pass urine at say 300 or 350 ml, your first urge is coming at some 600 ml. Mm-hmm. So you will need to check on that.
Okay. So the next question is just itching while passing urine. You have already answered. You said that cannot be classified as UTI. And one question again from the same person, Nishka. What about another myth that eating prebiotic and probiotic foods or vitamin C lessens UTI as a home remedy? Is this a myth or a fact?
A myth.
It is a myth. Okay. And Sandhya has asked, in case of the elderly who have incontinence and if surgery is not a possibility and medications cause burning sensation, what are the other solutions available for incontinence?
Okay. The adult diaper industry in the US is a $7 billion industry. So urinary incontinence in the elderly and the adult is something very close to my heart. That's a That's one more session. But anyway, again, no adult also should leak urine. There is no need to leak urine. Incontinence is of two types. You have stress incontinence, where when you cough or you laugh or you climb stairs or lift weight, you leak urine. And then you have urge incontinence, where before you go to the bathroom, you leak urine. And then you have mixed, which is a combination of both. So urinary incontinence is something that can very well be evaluated. And I would say 60 to 70% of them get very good relief with proper medications.
Okay. Thank you, doctor. So one other question, what could be the cause of constipation, a burning sensation in the urinary tract and in the anus while passing urine or stools, or even otherwise?
No, constipation itself can cause that perianal pain and itching and burning sensation there. And remember that our brain controls the bladder and the bowel through the spine. The nerves supplying the rectum, anus, the urinary sphincter and the bladder, the nerve roots are all the same in the lower spine. So therefore, both of these, most of the time, are related to one another. I will let you in on one more fact. Human beings are the only quote unquote animals that have control of the bowel and the bladder. No one else has. No other animal has. It is automated. When the bladder fills, they empty. When the bowel fills, they empty. They do not look at an appropriate place, time, etc., etc., etc. So when the pendulum swings on the other side, and when you hold for a longer time, you'll get into trouble. And human beings also, this has evolved over probably, we don't know, probably over many, many thousands of years. This is something that has evolved.
SV Pati has asked, what is the difference between urine test versus urine culture test?
Yeah, urine analysis, urine routine, or a simple urine test is a test that you will get it in around 45 minutes. It tells whether you have protein in the urine, it tells whether you have sugar in the urine, and then the pathologist also looks under the microscope, and then they look for any evidence of pus cells in the urine, which is a probable indicator of urine infection or stone. The biggest advantage of that is it is available within an hour, and so that the doctor also can immediately start treatment. Whereas a urine culture is something where you need to culture it in an incubator and then grow that urine and grow the bacteria which is probably there in the urine, identify what is the bacteria, identify what antibiotics will be susceptible to that bacteria. That report takes around 2 days. Now, when a patient has symptoms, the doctor cannot wait for 2 days to start the medicine, because the patient has got symptoms only has come to the doctor. So you do a urine test, start the medications, tell them to come back with the culture.
So that is only complete treatment. Once the culture is done, only you'll know the organism.
So, yes, you'll know what is the organism, and you'll also know whatever the medicine that you have started, is it something that is working or not.
So, doctor, when you identify the bacteria, and you mentioned there are many types of bacteria, E. coli and the others, do they all work on this problem the same way?
Urine infection, yes.
Yes. So irrespective of the bacteria,
the symptoms are the same.
Okay.
But typically what happens is based on the number of times that person had UTI, some of them get resistant, means the antibiotic that you're giving today may work for one bacteria, but might not work for the other bacteria. Mm-hmm. And there is another thing. Some patients get infected with 2 or 3 types of bacteria, especially if the immunity of that particular person is very low, for whatever reason, post-operative, post-transplant, post-immunosuppressing medications, uncontrolled diabetes, post-cancer treatment, post-chemotherapy treatment. There are so many causes where the body's immunity is low, post-recuperation of some viral illness. We're seeing a lot of it post-COVID also now. We're seeing a lot of urine infections because that particular person's immunity is so low post-COVID. So these are all the types where the host, which is the human body, its defense mechanisms are low. So opportunistic bacteria or fungi, sometimes in isolation, sometimes together, they can overwhelm the systems. So that is why it is important to identify which bacteria it is.
So aside from the issues that you just described, which relates to the immune system, given that in India right now, there is an excess of prescription of antibiotics generally. So there is probably a high prevalence of immunity to these antibacterial medications, that they don't work because bacteria have become resistant. So you've got a problem there, right? In your ability to address a bacterial issue when there is urinary tract infection.
Yeah, you're right. Especially with somebody who has recurrent urine infection, they've been seeing multiple people taking a lot of medications, not yet evaluated, and then they start getting resistant. So I agree with you. That is a problem. See, you should also look at it from a public health perspective. You just saw those numbers which I gave about UTI. Practically, it is impossible to get all those million people to do cultures, millions and millions of people. See, we are talking about, say, in a specialty hospital like ours, where people are coming with a lot of complications, and therefore you're doing all of this. But when you look at a general practitioner or a pediatrician who sees probably 30 kids, 50 kids in a day, or a family practitioner who's seeing 30, 40 patients a day, it's not going to be possible for him to do a urine test, urine analysis, etc. Some of these things will go by experience, will go by habit, will go by convenience, will go by cost. So there are a lot of things. See, it's one easy thing to say that I want to do all these things, but in practicality, it may not be possible. So yes, overuse of antibiotics are there. The second rider to that question is, how many towns, villages have microbiology culture labs? There are, can you believe entire Karnataka has close to 230 pathologists and maybe around 180 microbiologists for a population of 8 crore.
Wow.
So there is a shortage. There is a shortage of doctors. There is a shortage of manpower. So when you look at doctors working in smaller towns, villages, etc., be it the doctor or the patient, what do they want? Symptom alleviation first. Then later all this. But the intelligent thing is that if it is recurrent, get evaluated. I'm not advocating all these battery of tests for everybody. It's not possible also. Our population is very big.
There is one comment here from Sudha. I'm age 50 and I'm frequently having UTI. I'm also a diabetic. I'll be getting spasm in my lower abdomen. I think she has to take your advice and get herself evaluated, right, doctor?
Yes, yes. Anybody with recurrent UTI, we've not been able to put a finger on the cause.
Okay.
It requires some effort. It requires effort on the patient, and it requires effort on the treating doctors also.
You were earlier talking about immunity, you know, the body has less of immunity to fight. So do life-changing incidents or stress, do they cause UTI, doctor?
Not directly.
Not directly.
Not directly, but see, stress hormones and cortisol can push up your sugars. If the person is a diabetic, that can happen. Second thing is maybe they just they're not passing urine on a time basis. Maybe they're not eating enough. They're constipated. Maybe they're not drinking adequate fluid because of all those events of those particular days. So all of those things can cause, but not directly.
Any exercises that you could suggest to strengthen the urinary bladder? One question from Sandhya.
Okay, pass urine every 3 hours.
Yes, pass. That is the easy one. So we just have to probably set the clock and get up and go, right?
So that's something that we do for kids.
Yeah.
I have kids, I'll show you. I mean, I didn't get to show you. I have a 7-year-old child who passes 1 liter at one time and passes only 3 times in 24 hours. Simply because they're very engrossed with whatever they're doing.
Correct.
So then we'll have to put an alarm. He's got one smartwatch there. Alarm, and every time it buzzes once in 3-4 hours. Again, they'll tell all the same things. I go, nothing comes. I don't feel like going.
Yes, exactly. So I think this is connected to elderly incontinence. If the spine is erect, would it help reduce the incontinence?
Sorry, I didn't get that.
If the spine is erect, would it help reduce the incontinence? I think you were talking about elderly incontinence. So if the spine is erect.
May I just come in?
Yeah, Sandhya.
Yes, so I was referring to the fact that the doctor mentioned the spine is the what connected to the anus and the urinary tract. And so I was wondering if an erect spine helps reduce the incontinence.
Yeah, that is true. But you should also understand that there is a dynamic difference in the way men pass urine and women pass urine. Women pass urine in the sitting position by gravity 80% of the time. The bladder does very little work, but the brain and the spine relax the valve where you pass urine, and therefore women easily empty. Men will need to generate pressure in the bladder, which is an active muscle contraction of the bladder, and then pass urine. So if there are any spinal problems which is affecting the bladder, it is a problem, bladder or the sphincter. Similarly, women will find it very difficult to pass urine in the sleeping position. It's very difficult. So therefore, an erect spine will definitely help.
So I think one person wants to know your contact details, doctor. I mean, for them to contact, should we say go to NU Hospital's website for that?
Yes, yes.
Venkat, can you just post the link for NU Hospitals Bangalore on the chat box so that people can just click on that and get the contact information so that in future they can connect with Dr. Prasanna. Venkatesh. Jay, over to you. I think we have done with the questions here.
Okay, thank you, Meghu. Dr. Prasanna, this has been one of the most informative, most enlightening webinar sessions we have had recently. It also directly speaks to the level of interest in the community at large, because you showed the numbers, and the numbers are really, really huge. And we see it daily in and out in every family. This is an issue whether we have kids or we have seniors at home. This is an issue that all of us have to contend with on a daily basis. So many of us are aware of the larger context of these things, but certainly not at the level of detail that you presented. So for that, that extraordinary easy way in which we could appreciate, thank you very much. It has been informative, very informative, and we thank you for that. We have just about reached the end of our session. Doctor, do you have any closing thoughts? Because I certainly don't have any questions at the moment, and I can always certainly reach out to you but when I do. Any closing thoughts on what you have to say?
No, thank you all very much for patiently listening out. And if there is anything that you wish to ask, you can always email me, or if you can go on to our website, there is enough information that is available, and you all can go through that. And thank you, Jay and Sandhya, for having me over. Thank you very much.
Thank you, Doctor. To the audience at large, just a quick FYI here. Sandhya and I do know Dr. Prasanna personally. We have met him many times. And we can say with utmost assurance that he's a person who has an extremely good grasp, as you all noticed today, on the issues that he specialized in. So if any of you have any further questions or a wish to interact, do certainly reach out to him, because this is something that is better addressed in advance of any future potentially much larger problem. So do feel free to click on that link and reach out to Dr. Prasanna. He's a very engaging, very expressive doctor, and you might actually learn a lot of interesting things along the way. Once again, Doctor, thank you so much for sparing your time for today's event. We certainly look forward to having you in the future, maybe focusing on some peripheral aspects or in a slightly different way to look at things. Pegu, yes.
Yes.
Anybody had a comment? I'm sorry, somebody.
Anybody wants to ask anything? We can go in for a quick question. We have a few minutes left. Okay, I think it was a wonderful session, Doctor, because I can see a lot of very good comments here, and it was really, so many myths were busted. And I have actually written down a lot of stuff here because so many things like the fundamental four and, the public toilet thing, which we all think, which is all
Yeah,
that is busted. And, wearing tights, all the WhatsApp forwards we keep on getting every day. And all those myths were busted, and none of this is going to affect. And like a very valuable suggestion which you gave, evaluate. If you have any symptom, you have to get yourself evaluated. So it was a wonderful session, Doctor. Thanks for your time. I know how precious time is for you doctors, and it was very informative. And audience, you can just check out the LBN People's Podium channel where this recording will be uploaded. You can always check back and go and listen to it once more, and you can share to the rest of the people who have missed this wonderful session. Okay, and watch out for the next Healthcare Insights, which is always the last Saturday of every month. Thanks, participants. I can see some global participants from Malaysia and the Gulf also. Thanks so much for participating. See you all next session. Have a lovely day. Yeah, Sandy.
I want to thank you for being a wonderful host as always, and the LBN team for being the tech partner supporting.
Thanks, Sandhya. Thanks so much for giving me this opportunity, because I feel that this awareness needs to go to the world. We'll keep on continually doing this, more and more informative sessions, so that so many myths were busted today. We learned so much. So thanks for this opportunity. Yes. Thanks for giving me this opportunity, Sandhya and Jay. Have a lovely evening, all of you. See you all next session. Thank you.